Has your child ever had the flu, started feeling better after a couple of days, and then suddenly got sick again? That second wave of illness is often due to a secondary bacterial infection, something I'm seeing a lot of this year in Hawaii, and here's why it happens. We know from pathology reports that when the influenza virus infects your body, it attacks the epithelial cells, the lining of your respiratory tract, basically the protective shield of your airways. If you do not have pre-existing antibodies to the specific strain of the flu, the influenza virus will replicate inside these cells, which leads to direct damage to the airway. Studies show that the damage to the airways is greatest on the 6th day after the initial infection with the flu, and it provides increased attachment sites for bacteria that may result in an invasive bacterial disease. So normally, our immune system and mucus may help trap bacteria like strep pneumo, especially if we have antibodies already to this. But after the flu, these defenses are compromised. It appears that the complicated immune response against the influenza infection, which is an intracellular pathogen, impairs our immune defenses against a bacterial infection, which is an extracellular pathogen. That's when the bacteria can move in, causing infections like pneumonia, sinusitis, or ear infections that now may require antibiotics. Staph aureus, or as you may have heard it, MRSA, can also cause a bloodstream infection if left untreated. And MRSA pneumonia can quickly develop into sepsis and septic shock, something I have seen. Both staph and strep can cause an empyema. That's a collection of pus in the cavity between your lungs and your chest wall. That requires antibiotics and sometimes drainage with a chest tube. And we typically treat that in a pediatric ICU. So, if your child starts feeling worse again after having the flu and improving initially, especially with a new onset of fever, chest pain, abdominal pain, or earache, it could mean a secondary bacterial infection that needs treatment, so you have to reach out to your doctor immediately. Ask your pediatrician about ways to prevent the flu and how to manage it and prevent these secondary bacterial infections.